we had a patient come in saying that she has some pain and discomfort, so we're going to see what her problem is. Hey Margot, so what's going on today?
Hi, how are you? I have pain on my upper right and lower left.
Okay, so I took a look at your x-rays and it looks like you have some deep caries there. And after thinking of our best treatment plan, it looks like we're going to have to extract those teeth. Does that sound okay with you?
Yes.
Okay, and I also looked at your medical history. It looks like we're all set for now. Has anything changed since the last time you've been here?
No.
No? Okay, so I'm just going to ask for your informed consent before we get started. If you could just sign here, please. Thank you. Before we get started, we have to talk about PPE. So for proper PPE, we need gloves, we need a mask, and we need eyewear. For the purposes of this video, I will not be wearing a mask or eyewear. And you should also be wearing a gown. Okay, before we get started, we're going to need to take your vitals. So I'm going to take your blood pressure and your respiratory rate. Does that sound okay?
Yes.
So let's start with your respiratory rate. Perfect, so about 60 beats per minute, which is perfect. And now your blood pressure. And that's about 120 over 80, which is perfect. So we're ready to get started. Are you ready to go?
Yes.
Okay, so we're going to be using lidocaine, which is our topical anesthetic. So it's just going to make you more comfortable when we give you the anesthesia. Is that okay? So we're just going to paint this right on. And we're going to let that sit for a couple of minutes just so you get a little numb. Okay, and now we're going to set up the syringe. So what we're going to do is we're going to take the needle. We're going to screw the needle onto the syringe. We're going to insert the carpule. We're going to push down on the thumb ring and engage the harpoon into the carpule. Then we can unscrew the cap on the needle, and we can check for flow so that we make sure that anesthesia will be engaged. Okay, so since we're going to be doing an extraction, we're going to have to give you some local anesthetic. So we're just going to look at our armamentarium for that. So we have the Minnesota, which is our cheek retractor. We have lidocaine, which is the benzocaine, the topical anesthetic. We have our syringe with our needles. We have the carpule, and then we have our instruments to take the vitals. So we're going to start off, you want to stop that? Before we get started, we're going to put on the lidocaine, which is topical anesthetic, and it's just going to make you more comfortable when we give you the anesthesia. Is that okay?
Yes.
So we're just going to paint that on, and we're going to let that sit for a few minutes just so it gets a little numb. So now that you're all numb, we're going to give you injections. So since you said your upper right and lower left hurts, we're going to be giving you a maxillary infiltration and a long buccal infiltration on the upper right. And then on the lower left, we're going to give you an inferior alveolar nerve block. Is that okay?
Yes.
So we're going to start with the inferior alveolar nerve block. So we're going to take our syringe, needle engaged, and we're going to come for the inferior alveolar nerve block. We're going to find our coronar notch. We're going to go medial to that, and we're going to try to find a pterygomandibular depression between the coronar notch and the pterygomandibular raphe. We're going to inject the needle until we hit bone. We're going to retract 2 millimeters. We're going to aspirate to make sure that we haven't hit a blood vessel and there's no blood. And then we're going to inject the anesthesia and then pull our needle out. So now, also for your lower mandibular molar, we're going to be using a long buccal nerve block. So we're going to take our syringe with the needle, and we're going to get it right by the mucous membrane distal to the last mandibular molar. We're going to inject the needle. We're going to aspirate to make sure we haven't hit a blood vessel, and then we're going to inject the anesthetic and then pull the needle out. So now we're going to be working on your upper right tooth. So what we're going to do now is we're going to take our topical anesthetic, we're going to dip it with a Q-tip, and we're going to stick it right above the tooth that we're working on. Okay, so now that you have the topical anesthesia, we're going to do our maxillary infiltration. So we're going to take our syringe, we're going to find the tooth that we're working on, and we're going to insert the syringe parallel to the long axis of the tooth into the mucobuccal fold. So we're going to insert our needle, we're going to aspirate to make sure we didn't hit the blood vessel, and then we're going to inject the anesthetic, and then remove the needle. So now that we're done giving the anesthetic, we need to properly dispose of the needle. So what we're going to use is the scoop technique. So I'm going to scoop up the cap, and then we're going to unscrew the needle and throw it in the sharps. We're going to pull back on our thumb ring, remove the carpule, and that's also going to go in the sharps container. And then we're going to put the syringe into the red bag. So now that we've finished giving you the anesthesia, I just want to ask how you're doing.
I feel fine.
Does everything feel alright? How do you feel numb on your lips?
Yes.
Oh, no. Okay, perfect. So if she didn't feel well, if she felt lightheaded, we could call the emergency hotline 89828, and we could give her oxygen if she needed to. But since she's feeling good, we can move ahead and extract the proper teeth. Thanks for watching.